My name is Niamke-Bervell. I am a student nurse at Eastern Virginia Career College. I have a patient in room 224 presenting with dyspnea, coughing, and wheezing, and she's just been diagnosed with asthma, so I'm going to go in and see her.
Come on in.
Hi, my name is Niamke-Bervell. I'm going to be your student nurse today. Let me just wash my hands. Can you please verify your name and date of birth?
Marianne Niamke, April 19th, 1964.
Okay, everything matches. Do you have any allergies?
No drug allergies.
Okay, so what brings you to the office today?
Ever since the seasons changed, I have been experiencing shortness of breath, coughing, and wheezing when I go outside. When I cough up mucus, which helps a bit, but it always comes back. The doctor says I have asthma. I know my father has asthma, but I'm not sure what it is.
So asthma is a disease of your airway. It's caused by inflammation and mucus secretion of your airway. The inflammation causes your airway to narrow, thus making it hard for the oxygen to get through your airway into your lungs, which causes the wheezing and the difficulty breathing.
Oh, okay. So what causes the inflammation?
So a lot of things can cause the inflammation. For example, exercise, allergies, perfumes, even smoking can cause the inflammation. Specific to your case, it's most likely the allergens. So whenever you step outside, your body whenever you come in contact with the allergen, your body produces histamine in response to that allergen. That histamine causes your bronchioles or your airways to swell up and secrete mucus, which makes it very tight and hard for the oxygen to get through.
Oh, I see. How did the doctor know I had asthma and not something else?
So we have a few different methods for diagnosing asthma. First one is a very thorough health history and figuring out what your triggers are. So for you, like I said, going outside and coming in contact with dust and pollen triggers your asthma, so that pointed us in the right direction. You also mentioned that your father has asthma, and asthma has a genetic component, so that also helped us figure out what it was. The doctor also conducted something called a pulmonary functions test, where we use a device called a spirometer to measure things like your total lung volume, which is the total amount that of air your lungs can take in. Your residual volume is whenever you exhale completely, what's left in your lungs. And your tidal volume, which is whenever you take in as much air as you can, how much air you can exhale completely. So those tests also helped us confirm your diagnosis.
Okay. So what are my treatment options?
So you have a couple of treatment options. I'm just going to reach for them back here. Your first option is a bronchodilator or your albuterol. Your albuterol works by relaxing those airway muscles or your bronchial muscles, and when it relaxes, it opens up. So it allows air to get to move through your airways a lot better. And this is a short-acting medication, so you use this in emergency use. So like if you ever go outside and you start to breathe in that pollen and you feel your airways constrict and you feel yourself start to wheeze, you would use your albuterol because it works very quickly. I'll leave this for you.
Thank you.
The next medication is going to be a corticosteroid. This is called Advair. Advair you're going to use after you use your short-acting medication, so after you use your albuterol. This medication is going to help also further relax those bronchioles, so you have more air going into your lungs, so it's not as hard to breathe. But the difference between this and that is that this is long-acting, so you need to use it after your short-acting so you can continue having those effects of like easy breathing. It's really important after you use this medication to rinse your mouth out so you don't get thrush or yeast in your mouth.
Thank you.
So evidence-based practice shows that using your albuterol with a spacer allows the patient to get more medication into their lungs. So I'm going to show you how to use that. So the first thing you're going to do is you're going to shake up your albuterol and then you're going to insert it into your spacer. Next thing you're going to do is you're going to take a deep breath in as well as you can and breathe out completely. Next thing you're going to do is you're going to put your mouth to the mouthpiece and you're going to puff. You're going to inhale all the contents in the spacer, a deep breath, and you're going to hold there for 10 seconds. After 10 seconds, you're going to exhale slowly through pursed lips, and then you're going to repeat for however many puffs that you are prescribed. Let me give that back to you. Can I have your Adavir, please? So your Adavir is a little bit different. It doesn't need the spacer. It has its own mouthpiece. So you're going to do the same thing. You're going to take a deep breath in, exhale all your air that you can. You're going to put your mouth to the mouthpiece, and you're going to pull the meter and take a deep breath in, hold for 10 seconds, and like I said, it's very important for you to rinse your mouth after this one.
Okay, thank you.
Do you mind demonstrating this teaching for me?
Okay. So I would shake my meter and I will insert it into the spacer. I will put the mouthpiece to my mouth, and before that I will inhale and exhale slowly, and then give myself a puff and inhale and hold it for 10 seconds and slowly release it, and do it however many times my doctor prescribed it. And then I will remember to rinse my mouth. I will also, with this one, I will put it already has a mouthpiece on it. So I will do the same inhalation and exhalation. And then I'll give myself a dose by pulling down the meter. And after I get my dose, I will hold it in again for however many, 10 seconds, so I can get the full dose. And when I finish, I will rinse my mouth so that I don't get infection in my mouth.
Great job. Do you have any other questions for me regarding your diagnosis?
No, right now.
Okay, so here is some additional information about asthma. If you have any other questions that come to you later on, feel free to call the office and either I or the doctor can help you out. Thank you so much.
Thank you.